I think there are two aspects to it. One aspect is there a safety signal? There's always been this concern, or not always, there was this concern raised in some of the earlier studies with these LAMA agents that, hey, is there a safety signal from them in terms of cardiovascular side effects? So that's been allayed now. So now we had previously one large study with tiotropium, and now we have another large study with aclidinium, which is part of this new combination, which are very well done studies, large studies, which show in fact that the incidence of what we call major adverse cardiovascular events or MACE events was, if anything, lower while being on the medication. So definitely not higher. Of course, that was the endpoint. I don't want to say that they protect, from cardiovascular events, but clearly the events were no higher and numerically lower than placebo, than patients on placebo. So I think that's one aspect of it. The second aspect is that if you are able to bronchodilate more, you're enhancing their oxygen delivery, you're preventing deconditioning down the road. So that all could also have benefits. If they're able to walk more, that's going to preserve their cardiovascular ability. So indirectly, this is speculation, but indirectly, I think keeping these patients optimally bronchodilated could actually lead to better outcomes, not just lung-wise, but beyond that. The bronchodilators are fundamental to the treatment of COPD. What's interesting is, yes, we are very focused on exacerbations nowadays in COPD, but 60 to 70% of people with COPD don't have exacerbations or very infrequent exacerbations. So, in that population, what you really want to treat is symptoms and dyspnea. And that's what you want to be able to do, and that's what the bronchodilators do well enough. Plus, though we've also come to realize that adequate bronchodilation, by whatever mechanisms, leads to a reduction in exacerbations too. So, therefore the trend now is to optimally bronchodilate, usually with 2 bronchodilators, and then if you still have persistent exacerbations or frequent exacerbations, then bring in things like inhaled steroids, and then we have a couple of other choices. So that's become, again, a step-up approach, different from asthma. In asthma, we tend to kind of throw everything in there and then back off. In COPD, it's still a step-up progressive approach, with the bronchodilators being central and fundamental.